Ladies and gentlemen, ladies and gentlemen, good day. And it is a good day. Not necessarily an easy time in the world, but it's unquestionably a good day. First, I want to thank everybody for taking time out of their busy days with the many other things they can do to participate in this, either here live or in the live stream that we have underway. We've already gotten some questions coming in from other places in the world, so that's sort of interesting to us. My name's Leslie Michelson, and I think I'm about to say this was my idea. We'll see at the end whether I want to give somebody else responsibility or take it. But I did generate the idea, and the reason I did is for a couple of reasons. The first is the two words, public health. Public health. For most of you in the room, those two words don't have a lot of specific meaning and content because it's vague, it's amorphous. But I will tell you that public health and the people who practice public health, the people who teach public health, are the people who have made among the biggest difference in the last 150 years in terms of benefits to our society. Public health community has been more responsible for the 60% increase in life expectancy than almost any other community, yet public health is almost invisible. You don't see it when it works well. The only time that you become aware of public health generally is when you have threats to our existence, when you have threats to the world, like some people think the Ebola situation is. So what I wanted to do, because there's a lot of information out there about it, is to put together a panel of people who are experts in public health, who are experts in viral epidemiology, who are experts in the containment of these things, to give you the real information. If you listen to the World Health Organization, if you listen to the CDC, you'll get projections out in the January timeframe that truly run the gamut from this is going to be over in history to 1.4 million cases on planet Earth. To say that that's a wide variance is to understate it, and it can't be that wide. You have a right to know the truth. You have an obligation to know the truth. You are leaders in the community, and what we have here today are leaders in the public health community with the expertise to give you the truth. So my hope is that by the time you leave the room in a couple of hours or you sign off from the video conference that you're on, some of the demagoguery, some of the uncertainty will be gone. You'll have a sense of comfort about what's going on. And that will make a big difference because I would encourage you to share that. You're all leaders in your businesses, in your communities, and if you share it with the people who look up to you, that'll start to change everything. So it's a particular privilege to be here at UCLA with the hospitality of the Fielding School of Public Health, which I'm privileged to be a member of the advisory board on. It's a great place. We're going to have an opportunity for a lot of Q&A. We're going to have our very own Nancy Ayasi from WPO-LA as one of the presenters. You've all seen Nancy, you know what she does. I'm going to turn to Dean Jody Hyman, who leads the Fielding School, to introduce the panelists. But before that, I want to introduce the audience to the panelists, because what we have in the room and virtually are YPOers and WPOers and their associates from 11 different YPO, WPO chapters in the Los Angeles area and countless other chapters around the world. They're business executives and leaders who make a difference in the world, who need to know about the fabulous work being done by the Fielding School and the tremendous work being done by International Medical Corps. And in a couple hours, you'll understand why I'm so enthusiastic about it. So now I'm going to do the hardest thing in the world for me, which is to shut up. And I'm going to turn the microphone over to my friend and colleague and respected friend, Dean Jody Hyman from the Fielding School. Jody.
Thank you so much, Leslie. Thank you both for organizing this, inspiring this, and bringing these groups together, and for all you do on behalf of the school. So people from the YPO and WPO know you, others don't. Leslie is CEO of Private Health Management, but in spite of that title, he gets public health at a very deep level. And I can't imagine actually a better audience to bring together on this topic. So just so you do know the two halves of addressing this that are here, the YPO, WPO folks who are leading organizations that are going to be essential to how we respond nationally, globally, who are amplifiers because of who you reach in your communities, your clients, your stakeholders, and the Fielding School of Public Health people who are on the ground, and the LA County people on the ground responding to this. This is the kind of partnership we need around public health more broadly. So what are we going to do tonight? We're going to do a couple of things. I'm going to give you an incredibly fast introduction to emerging infections so that Ebola is in context, because this doesn't turn out to be the only pandemic, emerging infection, possible emergency or real emergency that we've had in recent years or will have in future. Then I'll introduce you to the panelists. We'll hear first about Ebola overall. Then we're going to hear about what it looks like in West Africa right now. Then we'll dive into LA County, and the best part, we'll open it up to everybody. So the brief introduction. What do we know about infections? This map, all you need to know is, so the bottom half here are emerging infections that happened up to 500 years ago. These are not new pandemics. Plague spreading across Europe. There's a whole long list. This map is what's happened recently. Really, I just want you to focus on one thing. Unless you live in New Zealand, that's the only place without any dots, you will be exposed. It's probably true of some small South Pacific island states. The thing about New Zealand is that the biggest cause of greenhouse gases in New Zealand is sheep. So it tells you something about exposure there. But, and this is particularly relevant to our business leaders, regardless of the size of the pandemic and whether or not it's a small infectious outbreak or a big one, the dollar amounts of impact can be staggering. I'm just going to take one. So this is SARS. $30 to $50 billion. Terrible that several hundred people died, but the number of deaths there happened in LA County in 5 days, less than a week, every week. But tremendous fear around the world. Fear led to the staggering level of economic costs. You can see the economic costs of some of the others. The bovine encephalopathy with 3.5 billion, that was one death. So the dollar amounts have more to do with reaction in the community than they do with risk. Now, I just want to mention two other diseases, not because we're going to focus on it, but just so you can think about the fact that diseases are spreading around the world. West Nile. Why a crow? So what happened with West Nile? We didn't used to have any West Nile in the United States. Then some crows started to die. The terrible thing if you're a crow and you die is people ignore it, so they ignored it. Then, okay, this is getting worse. I mean, I don't have a lot of I'm a dog person, so I guess I would have ignored the crows too. But then 2 older people died in New York City. Sadly, most people ignored that too. The docs primarily said, well, older people die sometimes. Then, okay, this is what really got our attention, the flamingos started to die in the Bronx Zoo. And they said, uh-oh, why are the flamingos dying? Well, it turned out that West Nile had come to the United States, and these slides are just showing you over the course of a couple years how far it spread, but it basically spread across the country and is now endemic. And there's a long story later afterwards in drinks. We can talk about how West Nile actually got here, but I don't want to distract us from Ebola for long. Just to say this notion of diseases spreading, where they emerge from, is beyond Ebola. It's a bigger topic that we all need to engage in together. And the solutions are not always simple. H1N1 gives us a little insight into that. That is the flu virus that came out in Mexico. And here's the point I want to make with this. They did everything right. Mexico has a tremendous public health infrastructure. They were public. They didn't try to hide anything. They notified the World Health Organization very fast. And yet, within a matter of weeks, the World Health Organization had to announce that there was the highest level of risk pandemic. So how did that spread? These maps will just show you, this is April 27th. A week later, May, July, August, very fast around the world. So there are other things that spread much faster than Ebola. This just gives you a look at airports for the influenza and anybody who had flights from Mexico it spread to. Now, I am not showing that to suggest that flights are the solution. Actually, quite the contrary. I'm showing this to say Ebola spreads much, much less than something like influenza. I hope, though, as we enter today, we'll think about how much of Ebola's risk, which is tragic and huge in West Africa, how much is that real here? How much is the greater risk here, other forms of public health, preventable diseases that are killing more people? What are the infections we have to worry about over time? And some of the panelists who are going to talk today have expertise not only in Ebola, but what it is that we should be thinking about in terms of other emerging infections. And I'm going to start there by introducing Annie Remoyne. So Annie Remoyne is an infectious disease epidemiologist. Please come on up, Annie, and join us. She's on our faculty here at the Fielding School of Public Health. Her expertise is emerging infections crossing species from animal to human populations, so she's the perfect one to dive in for us, both about why Ebola now and what do we have to think about other emerging infections. She works particularly in low resource and logistically complex settings. She's not only an internationally recognized expert on human monkeypox, she's deeply engaged in what's going to be done to sort of look for solutions to Ebola, as well as what do we do about eradicating diseases like polio that we actually have very clear tools. So please join me in welcoming Annie.
Thank you. Thank you very much. Thanks, Judy. I can put it here. Okay, great.